Welcome to week 2. I wanted to remind you of last week's. We went over the basics of homeopathy and starting out with the medical community and the differences between homeopathy and what's known as allopathic medicine. It's important, as I mentioned earlier, to learn this because as we strive to learn more how to treat our own family, we want to make sure that we're not feeling guilty for not taking our kids to the doctor, for not taking medications that we're not designed to cure, and rather we're looking for the things that can truly help our family to be as healthy as possible. In the past, when homeopathy was discovered in the 1700s, late 1700s, they did what's known as more of a classical homeopathy, and that is when you look for the single remedy. They spend lots and lots of times looking for symptoms, observing the patient, physical symptoms, mental symptoms, emotional symptoms, and they want to find the single remedy that most correctly matches the illness that they're dealing with. As time went on, I think people realized that this was not necessarily the most effective, simply because it was so difficult. There are still classical homeopaths out there, and sometimes they are necessary and they're a benefit. However, now we have what's known as modern homeopathy, and that is when we kind of know that certain illnesses are going to tend to treat well with these particular remedies. And most people, I think Joette mentions in a video that you're going to see in just a little while, I think she said 80% of the time people will benefit from what's known as the most common remedies for that particular illness. Sometimes we do need to go deeper and we do need to look more, but it's a great place to start. Modern homeopathy, you can find remedies even at your local Walmart. And I have some links that are going to be available to help us learn more about those in this course. What I wanted to start out with, the importance of understanding what true health is. That's called homeostasis. And that's a balance. That's when the body is in a state of balance. And while allopathic medicine looks at a symptom and says, oh, we've got to stop that symptom, whether it's a fever, whether it's a rash, whether it's a pain, inflammation, homeopaths look at the symptoms as sometimes the body's attempts to rebalance itself. When we really think of fever, oftentimes our body is trying to rebalance itself. It's trying to get rid of a bacteria that maybe have invaded. We've maybe gotten too tired, may have eaten some too much sugar, and our body is overtaken by a bacteria that may have already been in our body or been around us and not bothered us, but suddenly it is. And so our body tries to regain homeostasis through symptoms such as purging, sometimes through diarrhea, through vomiting and so forth, sometimes fevers to help to burn out that bacteria, to kill off. And sometimes the best thing to do is just leave the body alone and let it do what it needs to, other than, of course, say, keeping ourselves hydrated. And Joette will also talk about that. I wanted to read a quote from George Vidalkus. He's a German homeopath. He's a medical doctor as well as a homeopath from Germany, and he talked about consider for a moment what the ideal therapeutic system should be. This is what is the best treatment process for health and restoring homeostasis. He says, of course, it must be effective, but it must be effective with minimal or ideally no risk to the patient. Its effectiveness must be based upon not merely the alleviation or the absence of symptoms, but on the enhanced constitutional strength, which means making the body's immune system work better, and well-being of the individual, on the increased ability of the individual to live life to the fullest. It should not be prohibitively expensive, of course, and it should be readily accessible and understandable to all members of society. So that's a pretty good place to start when you're looking for a medical system that really works. To be cost-effective in teaching, by the way, what I did in this course was I looked for some of the best sources on the web. I could, of course, recreated these same videos and the same information, such as Joette does, but I decided to use her videos. And she's a great resource, and her introduction into homeopathy is very similar to mine, in that she started when she wanted to treat her family in a healthier way when her kids were young. The same thing that happened to me. She offers some great courses, products, and I plan on offering similar ones in group settings in the future, and it'll be more cost effective in the group setting. However, if you feel like you're just really ready to learn more, I would suggest Joette's course.